Okay, so these are the mechanisms of injury for different knee injuries. That's the unit that we're on. So the easy ones, we'll start with valgus and varus stresses. So if I'm in this position and let's say someone is coming this direction to tackle me and my knee goes out, that's a varus stress. So that's going to place stress on the LCL and I'm going to get an LCL sprain. If I'm in this position and someone comes from this side and hits me and forces my knee into a valgus position, that valgus stress is going to put pressure on the MCL and cause the MCL to sprain. If I'm in a deep squat position, let's say I'm in the weight room and I'm doing a squat position like this, and I start to come up from that squat position and I get a sharp pain at the joint line, then I would be concerned about the meniscus. If I'm in this squat position and the weight is too much and let's say I slightly twist, that's definitely going to be more stress on the meniscus because the condyles of the femur dig into the meniscus sitting on the tibial plateau, and when you get that twisting motion along with it, then that's when we're going to damage that meniscus. Okay. The other way that we can damage the meniscus and the MCL and the ACL is whenever we plant and cut. So you're in this loaded up position, weight bearing on this knee. Okay, you have this valgus stress because you're changing directions. You've got knee flexion, you've got some external rotation of the lower leg, and when you get into this position to change directions, now we've hurt potentially our ACL, our MCL, and our meniscus. Other ways that we can hurt just the ACL would be if we're running and then we come to a jump stop, and that stress, that forward translation of our femur over our tibia would damage the ACL. PCL sprains are going to come from getting force placing us into a hyperextension position of the knee. And the other way that we hurt PCL is whenever we land on our tibial tuberosity and the tibia gets shoved posteriorly. And so those are the major ways that we're going to hurt the ligaments and the meniscus. Okay?